Welcome to Cruise News, your daily update on everything happening at sea. Visit cruisenews.io to see today's stories and sign up for email alerts.
Glad to be here, as always.
So today we are looking at the latest industry news, and we've got a really fascinating lineup. We're going to explore how the global cruise industry is changing by looking at two, well, absolute extremes.
Yeah, talk about extremes.
Right. I mean, on one hand, we're tracking a rare, unprecedented medical crisis out at sea. And then we're shifting gears to look at practical traveler reassurance and how these massive billion-dollar port infrastructure changes are basically shaping future sailings on land.
It really is this crazy study in contrasts. You've got the industry managing this acute microscopic health scare out on the water, while simultaneously trying to navigate these huge politically charged urban development projects back on the shore.
Completely. Both stories just pull you in. Let's start with the medical crisis, though, because it highlights a vulnerability that, honestly, I don't think most travelers ever think about.
Oh, for sure.
We usually picture modern cruise ships as these self-contained floating cities, right? Buffets, theaters, the works. But when a mystery illness strikes, that city suddenly becomes a very isolated island.
And that physical isolation completely changes the equation. I mean, a ship isn't just a mode of transportation anymore. It becomes a quarantined environment. Every single hour counts, and jurisdictional lines just start to blur.
Yeah, so to really grasp how complicated this gets, we need to look at the MV Hondius. This ship is operated by ocean-wide expeditions.
Right.
And the reports classify it as a Polar Class 6 vessel.
Yeah.
Which, for anyone not super familiar with maritime terms, that means this is definitely not your standard Caribbean sun cruiser.
Not at all. A Polar Class 6 ship has a specially reinforced hull, right? It's designed specifically to punch through summer ice, so it's built to reach these highly remote, untouched areas that regular ships just can't get anywhere near.
Okay, so on April 1st, this ship leaves Ushuaia, Argentina. It's carrying about 174 passengers and roughly 70 crew members, and it's heading toward Antarctica and some really isolated South Atlantic islands.
So it's a very intimate, highly specialized voyage. The passengers booking these expeditions are usually there for nature observation, bird watching, that kind of thing, exploring environments that just see very little human foot traffic.
Which actually becomes a critical detail in a minute. But let's look at the timeline first. On April 6th, so just a few days into the trip, a 70-year-old Dutch man falls ill. And tragically, he dies on board 5 days later. The ship eventually reaches St. Helena, which is this incredibly remote island, and his wife disembarks with his body.
Right.
She flies to South Africa, but then her condition rapidly worsens and she also passes away.
This is devastating.
It is. But meanwhile, the ship has to keep moving, so it sails toward Cape Verde off the coast of West Africa. And by this point, 2 more people on board need urgent medical care.
And this is exactly where a medical emergency transforms into basically a geopolitical standoff.
I'm so glad you called it a standoff, because when I was reading up on this, I was genuinely so confused by the chain of command. I mean, you have a ship flying a Dutch flag, right?
Yeah.
And passengers holding passports from 23 different countries, and you're floating in the territorial waters of an African nation, Cape Verde. Who actually gets to make the call here?
It's a logistical nightmare.
Right, because Cape Verdean doctors actually boarded the ship to check on the patients. But then the local authorities, understandably, I think, they hesitated to approve an evacuation to their own hospitals.
Well, yeah, if you look at international maritime law, Cape Verde has sovereign authority there. Their #1 job is protecting the public health of their own citizens.
Right, of course.
So they're looking at the ship carrying some completely unidentified, highly lethal pathogen. If they let those patients onto land, they risk introducing a plague to their local population.
Yeah.
And the ship's captain answers to the flag state, which is the Netherlands. But the Netherlands can't just force an African nation to open its hospital doors.
Okay, so if everyone is kind of stuck in their own silo, how do you break that gridlock? Because you have patients actively deteriorating on this ship.
That's where the World Health Organization has to step in. They act as the ultimate diplomatic and medical mediator.
Oh, interesting. So the WHO takes over.
Basically, yeah. A WHO official on the ground in Cape Verde detailed how they had to do this incredibly rapid, high-stakes risk assessment. They had to coordinate between the ship's operator, the Dutch government, and Cape Verdean authorities to find, a tiny logistical loophole.
What kind of loophole?
A way to safely extract the patients using extremely strict isolation protocols. Basically something that satisfied Cape Verde's security concerns without sparking a local outbreak. And they actually managed to pull it off. They evacuated 3 people, including 2 who were showing symptoms, before the ship was allowed to sail north to the Canary Islands.
And Spain eventually accepted the vessel so all the passengers could evacuate, and the ship was sent to Rotterdam for deep decontamination. But, and this is wild, while that whole standoff was happening out on the water, there was a literal scientific race happening on land to figure out what the invisible threat was.
Because nobody knew what had killed those first 2 passengers?
Exactly. It reads like a thriller. So on May 1st, Dr. Lucille Blumberg, she's an infectious disease specialist in South Africa, she gets this urgent email. One of the evacuated passengers, a British man, is sitting in a Johannesburg hospital with suspected severe pneumonia.
Right, and her team just jumps into action.
They did. They worked straight through a public holiday. And what I found so fascinating was their process of deduction. They didn't just run random blood panels. They specifically looked at the environment of a cruise ship.
Yeah, that epidemiological process of elimination is amazing. They started with the most statistically probable culprits. I mean, the first test was for Legionella.
Which makes sense, because Legionnaire's disease is fairly well documented when it comes to hotel and ship water systems, right?
Exactly. But that test came back negative.
Okay.
So then they tested for bird flu, which, again, is an incredibly logical deduction because these passengers were on an expedition ship specifically out there bird watching in remote colonies.
Right. But that test was also negative.
Yep. And when you rule out the common maritime and environmental threats, you have to look really closely at the specific itinerary. You're looking for that mechanism of infection.
And that one geographic detail is what broke the case wide open. Dr. Blumberg's team looked at where the ship departed from, which was Argentina, and they saw reports that these passengers had been hiking and looking at wildlife in areas of South America where specific types of rodents live.
Right, the local fauna.
Yeah. So that prompted them to test for Hantavirus. And the blood samples from the British man, they came back positive. But not just any Hantavirus, specifically the Andes strain.
Which is terrifying.
Seriously. I mean, typical cruise ship protocols, like, the standard vessel sanitation programs, they are mostly designed around things like norovirus, the classic 24-hour stomach bug, or just regular respiratory flus.
Yeah, exactly.
So how does a hantavirus completely upend the way public health authorities handle a ship outbreak?
Well, it requires a completely different playbook. Standard protocols focus heavily on surface sanitation, right? Food handling, making sure the buffet is clean to stop gastrointestinal spread.
Right, wash your hands, use the hand sanitizer.
Exactly. But hantavirus operates on a totally different biological mechanism. People usually get it by breathing in aerosolized particles from infected rodent urine or droppings or saliva, so it's an environmental pathogen, not a foodborne one.
Okay, I see.
But what makes the Andes strain specifically so uniquely terrifying is that it's the only variant of hantavirus that is documented to spread from person to person.
Wait, really? So the whole threat matrix just flips?
Oh, completely. It goes from, oh, someone touched a dirty rock in Argentina to, these passengers might be actively infecting each other just by sharing a cabin on the ship.
Wow.
Now, human-to-human transmission of the Andes strain is rare, and it usually requires really close, prolonged contact with someone who is already highly symptomatic.
Okay, that's a relief at least.
But still, just the biological possibility of it spreading between passengers, that elevates it from a localized hazard to a potential contagious outbreak.
Right. Now, researchers at the Pasteur Institute in France later sequenced the virus from a passenger and confirmed there were no new mutations making it more dangerous, which obviously, massive relief.
Oh, huge.
But that initial discovery was just a blaring red flag. Dr. Blumberg actually called it a true wow moment when she ran a posthumous test on the Dutch woman who passed away and confirmed she also had the virus.
Yeah, but the timeline there introduces a really terrifying complication for international authorities.
Yes, the disembarkation. Because by the time this virus is positively identified, which was May 1st, about 30 guests had already gotten off the ship way back on April 24th at St. Helena.
Which is just the absolute nightmare scenario for an epidemiologist. You have dozens of people who have already scattered across the globe before you even know what deadly pathogen they might be carrying.
Right. And I was trying to put myself in the shoes of one of those passengers, just to grasp the scale of the problem. Imagine you're on that ship, you had a lovely time bird watching in South America, you feel completely fine, you fly home to the US or Europe, and you go back to work.
And you have no idea.
None. Because the incubation period for hantavirus can be anywhere from 4 to 42 days, sometimes up to 8 weeks.
8 weeks is a long time to be walking around.
Seriously. You wouldn't even think to tell your local doctor about some mouse you might have seen in Argentina 2 months ago. So doing contact tracing on this, it must be like trying to trace a single spark in a fireworks factory a month after it burned down. The fuse is just way too long.
That's a perfect way to put it. I mean, authorities across multiple countries suddenly had to scramble. Tracking down flight manifests, contacting families, monitoring workplaces, isolating people who are just going about their day. The sheer logistical weight of that operation is staggering.
Which naturally leads to the big question about traveler reassurance and consumer confidence. Because, look, if I'm booked on a summer cruise out of Miami and I open my phone and see the words Hantavirus and biocontainment, my luggage is staying firmly in the closet.
I mean, that's a very natural reaction.
Right. So how does the industry actually manage the panic that a story like this generates?
Well, they manage it through transparency. They have to show the scale of the response compared to the actual statistical risk to the consumer. Honestly, the massive, overwhelming safety response to the Hondius is the exact thing that should reassure people.
Okay, break that down for me. How does a massive emergency response prove that cruising is safe?
Because it proves that the containment infrastructure actually works. Let's look at the final numbers from this incident. The total outbreak linked to this specific voyage resulted in 11 confirmed or suspected cases with 3 deaths.
Which is tragic, obviously.
It is. But look at the containment net they threw over it. In the U.S. alone, over 40 people were closely monitored. 18 evacuees arrived in Omaha 16, went straight to Nebraska's National Quarantine Unit, and 2 got highly specialized care at the biocontainment facility in Atlanta.
Wait, biocontainment in Atlanta?
Yeah.
Like the CDC?
Yes. But here's the key takeaway. Despite all of that exposure and all those people flying back, there have been 0 confirmed domestic cases tied to this outbreak in the U.S.
So the net caught everyone before it could spread into the general public.
Exactly. And just to put the broader risk into context, CDC data shows there have only been 890 laboratory-confirmed hantavirus cases in the entire United States over a 30-year span, from 1993 to 2023.
Wow, so it really is incredibly rare.
It is. Dr. Jorge Salinas, an infection prevention expert at Stanford, was very clear about this. He said, for anyone taking a summer cruise, the risk of contracting hantavirus is, quote, very close to 0.
So health experts are basically advising cruisers not to cancel their plans. Just use routine precautions. Good ventilation, regular hand washing, monitoring for flu-like symptoms, standard stuff.
Right. The basics.
And what's interesting is how the cruise lines are visibly adapting their daily operations to lower baseline risks, too. Lines like Carnival and Norwegian have added subtle safety measures to reduce capacity in crowded public spaces.
Yeah, they're definitely paying more attention to crowd flow.
And I thought this was particularly smart. Royal Caribbean is utilizing in-stateroom video telehealth consultations.
Oh, that is brilliant from an infection control standpoint.
Right.
Think about it. It prevents a passenger who has some mysterious, potentially contagious cough from sitting in a crowded medical waiting room right next to a guy who just sprained his ankle on the pool deck.
Exactly.
Yeah.
It's all about controlling the variables. Which actually brings us to the second half of today's coverage, because we just spent all this time talking about how fundamentally powerless the industry is when a wild, microscopic threat boards the ship.
Yeah. Nature is going to do what nature does.
Right. So to take back control, the cruise lines are aggressively pouring billions of dollars into the one thing they can completely govern and engineer: their land-based infrastructure.
And that transition is huge. The physical spaces where passengers interact with the shore, the ports, the terminals, they're undergoing a transformation that's honestly just as dramatic as the health protocols.
It's staggering in its scale. So we have this company called Cruise Terminals International, or CTI. It's led by Gregory Lanter, who's used to be an executive at Club Med. CTI currently has a casual $1.3 billion in active investments.
Wow.
And they are evaluating another $2 billion in future opportunities. They operate Terminal A at Port Miami, which processes over 160,000 passengers in a single month.
That volume is just insane.
It is. But they are aggressively expanding globally, too. Into Ravenna in Italy, St. Thomas in the Virgin Islands, and Barcelona, Spain. Lanter gave this quote that really frames this whole shift. He said, the old model of a terminal as a simple processing facility is over. He said, a cruise terminal is the first and last impression of the journey.
It's a total rejection of that old logistics-first mindset.
But how do they actually execute that globally? Because, if I look at airports as an analogy, it used to be that you'd sit in this sterile, fluorescent-lit waiting room on a hard plastic chair just waiting for your flight.
Yeah, terrible experience.
Right. But now, Major international airports are basically high-end shopping malls with luxury lounges. CTI seems to be trying to do the exact same thing for cruise terminals.
That's exactly the playbook.
But here's the thing. Every single port city has different laws, different environmental regulations, totally different local politics. So how does one single company scale a bespoke, high-end experience across so many fragmented, unique markets?
Well, the mechanism they use is a hybrid operational model.
Okay, what does that mean?
Lanter explains that CTI functions as a scalable platform, not just a series of isolated local construction projects. So they maintain this strict central operating platform that dictates universal design standards, efficiency playbooks, procurement practices, the big picture stuff.
Gotcha.
But, and this is key, they rely entirely on localized teams to navigate the specific community politics and the local regulations of each port.
And they have massive institutional power backing that platform. The reporting notes that Royal Caribbean provides the industrial backbone, while an investment firm called Icon Infrastructure provides the long-term capital.
Yep.
Now, when they say industrial backbone, I'm assuming that means leveraging Royal Caribbean's massive supply chain and operational data so they can build these terminals perfectly to spec for modern megaships.
That is a crucial advantage because mature markets like Miami or Barcelona, they need massive, highly engineered upgrades just to handle the physical displacement and the passenger volume of modern vessels.
Because the ships are just getting bigger and bigger.
Exactly. And meanwhile, emerging destinations, they want to partner with CTI so they can build their infrastructure correctly from day one, rather than having to retrofit some outdated, crumbling dock 10 years from now.
Right. And there's always but pouring billions of dollars into a city's waterfront creates intense friction. Which brings us to the major pushback we're seeing, because not everyone wants a shiny new mega terminal in their backyard.
No, they definitely do not.
Let's look at Barcelona. CTI is building Terminal G there.
Yeah.
And they are aggressively engineering it to be as environmentally friendly as humanly possible. It's targeting LEED Platinum certification.
Which is very hard to get.
It is. Functionally, that isn't just a plaque on the wall. It means the building is designed to physically generate more energy than it consumes, and they're integrating local art and marine research facilities right into the architecture itself.
Yeah, if you look at it strictly from an engineering and corporate responsibility standpoint, it is a massive technological achievement. They are really mitigating the environmental footprint of the physical structure.
Right, but here's my challenge with this. CTI is pouring billions into making this terminal a net positive energy marvel. But the mayor of Barcelona, Jaume Collboni, is publicly stating, and this is a direct quote, "I want to discourage the arrival of cruise passengers."
Yeah, he's not mincing words.
Not at all. He's actually doubling the cruise tourist fee from €4 to €8. So it sounds to me like the building itself isn't the problem. Can a beautiful zero-emission terminal actually solve the fundamental human problem of overtourism? Because the sheer volume of people is what the locals are protesting, not the energy efficiency of the waiting room.
You've just isolated the defining conflict of the modern cruise industry right there.
Have I?
Yeah, I mean, a LEED Platinum building doesn't change the fact that thousands of human beings are suddenly walking on ancient cobblestone streets all at once. To understand why cities are fighting back and how these infrastructure investments are trying to solve it, we really have to look at the economic mechanism of how ships operate.
Okay.
We need to define the difference between a home port operation and a transit call.
Okay, let me see if I understand the mechanics of this. Is a home port operation essentially turning cruisers into traditional tourists? Like, if a cruise begins and ends in Barcelona, the passengers usually fly into the city a day or two early. Right? So they pay for local hotels, they eat at local restaurants, they take local taxis, they're injecting significant capital into the local economy before they ever step foot on the gangway.
You hit the nail on the head. That economic injection is highly desirable for a city. They love that.
Right.
But that is fundamentally different from a transit call. A transit call is when a massive ship carrying 5,000 or 6,000 people docks in a city for just, say, 8 hours in the middle of a voyage.
Oh, I see.
Yeah. So those thousands of people flood the city center simultaneously. They might spend €5 on a gelato or, a souvenir magnet, and then they walk right back onto the ship to eat dinner because their meals on board are already paid for.
Wow. So the city absorbs all the infrastructural strain, the traffic, the crowding, the trash, but receives almost none of the economic benefit.
Exactly. And that economic reality completely reframes Barcelona's current strategy. The city is actually in the process of replacing 3 smaller, older cruise facilities with one massive new terminal capable of handling up to 7,000 passengers a day.
See, at first glance, building a much larger terminal seems completely counterintuitive if the mayor's explicit goal is to discourage tourists. But functionally, this is about behavioral modification, isn't it?
It absolutely is.
By consolidating the infrastructure into one highly efficient megaterminal, they're trying to force the cruise lines to use Barcelona as a home port, rather than just a quick transit stop.
That is the exact mechanism at play. It's a strategic consolidation. Barcelona officials are trying to reduce the sheer quantity of single-day transit visitors while prioritizing the quality of the economic impact that comes from home port operations. Basically, they want the hotel stays. They don't want the 8-hour foot traffic. That makes complete sense. They aren't saying ban all ships. They're saying, if you want to bring your ships here, you need to structurally invest in our local economy rather than just using our city as a brief walking park.
Right.
And that is why CTI's investments are so critical. They aren't just building fancy waiting rooms. They are engineering the complex high-capacity infrastructure required to support those massive home port operations that cities actually desire, while simultaneously trying to hit the strict sustainability targets that local governments are now mandating.
It perfectly illustrates how interconnected every single aspect of this industry has become. I mean, every time a modern ship leaves a port, it is navigating both the unpredictable forces of the natural world and this deeply complex, highly political web of human infrastructure.
It is incredible when you pull back and look at the whole picture. Today, we've traced the journey of a microscopic variant of Hantavirus off the coast of Africa, triggering this massive multinational medical extraction, all the way to billions of dollars shaping concrete, steel, and urban policy in ports from Miami to Barcelona. It really proves that a cruise ship is never just an isolated bubble floating on the ocean. It's tethered to a massive global system.
Absolutely. So the next time you step onto a ship, or honestly, even if you just see one docked in the harbor of your city, you'll understand the massive, often invisible web of international health protocols, diagnostic science, and urban planning that works behind the scenes to make that single vacation possible.
It definitely gives you a profound appreciation for the logistics of modern travel.
It really does. And it leaves me with one final, slightly provocative thought to ponder. We talked earlier about how the Hondius outbreak was directly linked to an expedition into incredibly remote wildlife habitats.
Right.
As modern cruisers increasingly demand to go further off the beaten path, paying premium prices to see untouched nature in the Arctic or remote corners of South America, will the industry have to completely redefine what it considers a routine medical risk? Because if we continue to push further into the wild might just push back.
That's a great point to end on.
Thanks for listening to Cruise News. Visit cruisenews.io to catch up on the latest updates and sign up for free email alerts.